Welcome to the office. Nice to meet you guys. You're coming from India?
Yes.
Okay, क्या problem है?
So the main reason for us coming here is she suffers from headache, a lot of headache.
Okay.
And that came because of the sinuses, and she doesn't.
You'll need to take your mask off. You know that if we're dealing with all. You're okay with it?
Yes.
Okay. So sinuses, nausea.
Nausea when she has headache.
Okay.
Yes.
Turn this way. What else?
She has neck pain
Okay.
and knee pain.
Okay. Accidents,
Yeah, she
trauma, slips, falls. You've had a few things going on in your body.
Yeah, she fell over off a bike like in 6 years ago.
Motorcycle?
Motorcycle.
Okay. You were riding?
Yes.
All right. Good for you.
Yeah, and she injured her shoulder. I
Okay.
think it was a fracture, and doctor has to
Shoulder
use
and leg.
leg as well. They over there.
Okay.
Doctor used some sort of steel things to patch it up inside.
So they put some pins in there
I think
to
so.
hold it in place.
Yeah.
Okay. But number one is the back or the sinus congestion?
Sinus congestion.
Headache, heavy headaches.
All of this. And it's all here, not on the top. Idhar bhi hai?
Here also.
So where does it start?
From here it will start.
Okay. And it's all the time?
Yeah.
Yeah, mostly she has very mild headache all the time, but
All
if
the
there is a lot of heat or a lot of cold, or if she has something too cold, it spreads over, and then she says sometimes the pain is too severe, sometimes it goes down a little bit.
So the temperature affects it?
Also, yes.
Also, yes. Okay. And you've been having this for how many years?
Since 10, 11 years.
There's no treatment in India?
We went to a lot of doctors. A doctor suggested us that she had a deviated nose, and which is causing this issue. But some other said there's nothing to worry about with that deviated nose. She used a lot of medications too, but that's when she started to have high blood pressure because of the medications. I guess I don't know. She
Okay.
never had them before. Yeah, now they're all interlinked. Whenever she has face pain, she has headache, and that leads to high blood pressure.
It's all connected now.
Yeah.
Okay. Are you on medication right now?
Yeah, a lot of many doctors I consulted, sir.
Yeah, she's taking high BP tablets.
What else?
That's all.
Okay. You know why you're here? You know why did he bring you to me?
Yeah.
Kyun? Why did he bring you to me?
He is telling many times. He told me many times about you, sir. But we can't come here.
From India,
Yeah,
eh?
from
Yeah.
here. And that's why we.
You're here now. Take it. Okay. Here's what we're going to do. I'm going to go over your x-rays. I'm going to explain what I see. We're going to start here with the A to P film. And we can see we have a few things going on here. We have a lot of rotation of the pelvis. We have a short leg on the right. And from that you can see the hips are wearing out a little bit more. Now, let's go to the numbers and let's see what this is. Okay, this makes a lot of sense now. So, we have a short leg on the right side. The measured difference is 11 millimeters. We have rotation of the pelvis on the left, we have rotation of the sacrum on the right. Here's the answer. She has an old tailbone injury. Sound familiar? Sacrum, posterior 6 millimeters on the right and down 4 millimeters. 4 millimeters is contributing to this 11, okay? And 1 millimeter is contributing from the pelvis. So the left pelvis turns in this way. And the sacrum on the right goes back. So she has a disconnect. She got a waddle when she walks. She got the Hyderabadi waddle. So that's her issue in her foundation. We need to decide, are we going to start on the sacrum or the pelvis? I'm pretty sure we're going to start here on the sacrum. And you can see right here that there's tilting of the sacrum, and it starts at the bottom. So that's probably where we're going to start. That short leg on the right is creating this slight curvature here. And what the body does is this, it's curving and then it's coming back to neutral here. And then right when we get to around the mid-back, what is it doing again? Now it wants to go to the right side. So starting from the base here, we have the short leg on the right, we have the rotated sacrum on the right. It takes all of this up to the middle of the back, and from the middle of the back, what does it do? It kinks the opposite way. Next thing, we have a lot of digestion issues going on here. She's got a lot of digestion issues as well. She has a lot of undigested food in the colon. I hardly see a Blvd here. The control of the stomach and the acid is all coming from around this area here. I need her to get her thyroid checked while she's here, would be very nice. She's starting to get a lot of calcification of her ribs here, and we need to rule out thyroid. It's very, very important. If we don't rule out, I'm pretty sure there's an underlying thyroid problem if she hasn't already been diagnosed. If we don't address that and figure that out, she will always have pain. Nothing will be fixed. I don't see the pins in the shoulder because I don't see enough of the shoulder there. Okay? I see the scapula. Scapula looks off a little bit. Now, let's go to the side profile. This is the major issue I see here, dude. So we know there's that tailbone. We know there's that rotated sacrum. Look at her L5. This has taken on a lot of issues. So when we look at her L5, the bones are jaggedy. She had some good traumas down there. But here's the good news. She has still maintained and held the rest of her discs are good. Okay? There's a lot of scar tissue in there, and the end plates are a little irregular, so it's going to be a little spicy. Achar gamte? You like achar? Spicy?
Pachadi istamana.
Look at her. She likes achar. It's going to be a little spicy, okay? Okay, good. Even the neck is really good. I'm impressed with the neck. I see this one going on. I expected your neck to be worse.
Okay.
I really did. I expected your neck to be worse. And then I'm going to explain what this case really is, okay? So forward flexion, this is the one here that didn't move. This one didn't move also, but we're down here at C6. C2, 3, 4, 5, 6. C6, sacrum, and whatever else we find in the middle along the way. Her 5 matches, so her C2, her posture line is decent. So even with everything she's had going on here, she's maintained her good side curves. Okay. And that's the one thing that saved her. So that's her blessing, okay? Let's go ahead and examine her. Let's see what we find.
Sure.
Okay? And what I want her to report is whatever changes are going to happen. Now, the body has some toxicity in there. I won't be surprised if she, after her adjustment, she may go have diarrhea. She may throw up. I don't know. Okay. But the body has toxicity. It has to come out somehow. Okay? I don't want you to be nervous about it. Mm-hmm. But whatever happens, just let it happen. Take it? She definitely got the Hyderabadi wiggle. So when we have decent movement of the right pelvis, keep going. I'm just talking. So there's a little bit of movement of that right pelvis, right SI joint, but it's doing this. Come on, Nico. Watch these. These are the dimples. You've watched my videos, right? You said? Yeah. This should go up and down. Hers goes like this. Okay. Go ahead and walk, please. So it shifts to the left and then it goes down to the right. It does this and down, this and down. It's not doing this. Do you see what I'm showing?
Yeah.
Take it? Okay. So first thing we're getting is 14 points at the base of the neck, 13 points, C6. That didn't break up top, that's heat. There, starts there, but it's a little bit lower. That's at the bra line around T8, T9, left side, 10 points. It's going to be a little spicy, dude. Let's see. There it is. That's your S3, S4, T18-9, base of the neck. Okay? Those are the three. Slide forward, madam. Feet together. Open and close the knees. Open and close. Left side only. Right side only. Left side. So the SI joints are decent. I'm not messing with the pelvis right now. Ye panche. Dukha hua hai? Pain?
No, pain unda?
Panch. Ek,
Oh.
do,
Pain unte cheppu.
or teen.
Pain.
But she said the previous two also she had.
Char, this one. Char or
Little bit.
char.
ఏది ఎక్కువ ఉంది?
ఇది ఎక్కువ.
Ek, do, teen, char.
This one's more.
Char. Take. A lot of swelling, a lot of edema throughout the whole spine, the whole body. This is a digestion case. This is maybe a thyroid case. She needs to rule out that thyroid. Thyroid is off a little bit. She has a lot of swelling in the body. 2, 3, 4, 5, 6, 7, 8. Yeah?
Pain.
9. 9, S4, and let's check up top. What language you speak?
Telugu.
I don't know this one.
That's fine.
Hindi I can understand, Urdu, Gujarati, and Kutchi.
Oh, nice.
Che. Che.
Pain unte cheppu no.
Here's where we're going to start. We're going to do the foundation first.
Okay.
From there, we're going to do the mid-back, and then we're going to do the neck.
Okay.
Okay?
Sure.
Along the way, if you need a minute for any reason, you're uncomfortable, just please just say, give me a minute. Okay?
Okay.
Are you ready?
Yes.
Ye panch hai. 1, 2, 3, 4. And we said we have a short leg on the right side, so we want to torque counterclockwise, this way.
Okay.
Oh, आराम से माँ, please, आराम से, नीचे, सांस लो.
అమ్మ ఊపిరి పీల్చుకో.
बस, हो गया, हो गया, हो गया, हो गया, हो गया, बस, बस, बस. Thank you, Shashi.
అయిపోయింది.
Bus. 5, 4, 3, 2. Guess what? That wasn't it. We're gonna have to go on this table. Like that. Don't worry, but I got it, okay? Madam? You ready, madam? I got you, okay? I know. Hot there. Hot there. Hold my hand, hold my hand. You're gonna be okay. You're gonna be okay. You're gonna be okay. Hot pakad. Hot lao. Hot lao. You're gonna be okay, don't worry. Come on. Let's go. I got you, don't worry. Turn. Turn. This one. This one. But we'll wait and see. Keep walking, please, madam. Please, keep walking. I know it's sore. I know it's a little spicy. I told you it's going to be a little spicy. Turn around, please. Let me open the back of your gown. Oh, देखो, dimple है. Walk, walk for me, please. देखो. Now it's going up and down.
The pimples are visible now.
Yeah. You're gonna be fine, madam. Walk. Chalo, chalo, chalo. Walk, walk, walk. It's gonna force you straight. If you try to slouch, it's gonna hurt. Tell her. If she sits straight, she's gonna be good.
Straight కూర్చోండి. వంగడానికి ట్రై చేస్తే నొప్పి వస్తుంది అంట. రిలాక్స్డ్గా ఉండు, డీప్ బ్రెత్ చేసుకుంటాము.
C6. C6.
దిగబెట్టకు, ఎటైతే వదిలి చేస్తాం.
Good. आराम से. Gotcha.
దిగబెట్టకు.
Hi, madam. Bashi, bashi.
What does that mean?
Soft. Just, you know.
Okay,
Like I teach my kids bashi, bashi. Soft. 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 Sit up straight, please. Okay, can you walk for us? Now it's easier to get up. Now it's a little bit easier, right?
లెగడానికి ఈజీగా ఉండాలి.
Keep walking. Chalo. Chalte, chalte. Can you ask her what's different for her?
ఏమన్నా డిఫరెన్స్ ఫీల్ అవుతున్నావా ఇంతకు ముందుకి ఇప్పటికి నడవడంలో, కూర్చొని లెగడంలో? She said she can't feel the difference yet.
Oh, okay. Got it. Come back over here and have a seat, please. Let's run the meter on the back and let's see.
Pain.
So,
నొప్పి ఉందా నీకు?
have a seat. Starting at the base. C6 is clear. Mid back is clear. Remember what I said in the beginning. She may go throw up. She may have diarrhea. Whatever it is, let it come out. Dekho ma. Piche. All the way back. Punch. Ek. Do.
పెయిన్ ఉంటే చెప్పు.
3. It's moving now. 4.
ఇందాక అక్కడ పెయిన్ వచ్చింది.
Good. Different, right?
Yeah.
हाथ लो. बस. सांस लो.
Breathe.
Bas. On your back here, please. Let's do your feet. Raise your right leg, madam. Right leg upar. Thank you. Relax the leg. Relax, relax. Chordo, chordo. Bas. Up. Chordo. Bas. Have a seat, sit, and actually no. You know what? Let's do her nose. Here's what's happening. तुम्हारा नाक इधर, ये साइड ठीक है, ये साइड ठीक नहीं,
Okay.
ये सही प्रॉब्लम है. तो ये लेफ्ट साइड है. We're going to adjust left to right side.
Okay.
ठीक है? Okay. Chin down, madam. Down. Home run. That moved.
Oh, thank God.
You ask her. That moved. सांस ले आओ. छोड़ दो. ठीक. Come on up. Check it out. Very nice.
కదిలేట్ అనిపించిందా ముక్కులో? ముక్కులో కదిలేట్ అనిపించిందా? Yeah, she felt it.
So, we'll see what kind of changes are going to happen in the next 24 hours. I said I'll give you 2 things to take. Her homework with me is very simple. Water, walking, and ice.
Okay.
She's on blood pressure medication. I need to say something about that. I will never tell anyone to take or not take medication. So I've had many cases of this with blood pressure, people on blood pressure meds. What you look for, if her blood pressure starts to drop too low for any reason, she needs to get her blood pressure medication reevaluated. It's too much.
Okay.
I've seen it hundreds of times.
Okay.
Hundreds of times. Okay? We got good sets on you today. We'll see what happens. Make note of anything changing. You go back, I need you to steam. You need to drain all this stuff out.
Okay.
Okay? Do you have any questions for me?
ఏమైనా క్వశ్చన్స్ ఉన్నాయా?
Everything is good.
Welcome to the office.
Thank you.
Nice to meet you, sir.
Nice to meet you.
Nice to meet you too.